Hello, I'm Graham Currier. I'm a chiropodist, a UK trained podiatrist, and we're going to talk to you today about fitting running shoes and how to select the most appropriate running shoe for your clients. The important thing to understand about any shoe is that it needs to allow the foot to do what it is supposed to do. Now, we've created an environment which is unnaturally hard and flat, so it doesn't allow the correct bending of the forefoot, and therefore if we fit a shoe which doesn't flex in the right place, we're not going to get a correct function. When I send a client to look for a shoe, I will usually say go in the afternoon. The volume of the foot is greater in the afternoon, so what you should fit the shoe then, which allows you to lace the shoe a little tighter in the morning, and then if it gets a little snugger, especially as you run, you tend to get some swelling, you can loosen up the shoe and allow for more room. The next thing I say is, when you go and look for a shoe, is you pick the shoe up and keep your hands open and push the sole. Now you can see that this shoe bends about 2/3 the way up the length of the shoe, and that is where your great toe joint is, and that's where you're supposed to bend. Alright, some of the shoes that you'll get will flex and look like they're going to bend in the right place, but they will actually flex too far back. That in itself will create a dysfunction of the foot and lead to problems associated with the shoe. The other thing to consider is that the concept of pronation and motion control is being challenged in science, and it's not necessarily correct to suggest that somebody with a flat foot should have a motion control shoe. So if you have somebody who is flat foot and you think they might need a more supportive shoe, it may be an idea to have them assessed biomechanically just to ensure that that's the case. A lot of the times, if we're going to consider some form of orthotic, it's better for the patient to have a neutral shoe, so that we can ensure that the orthoses that goes in that shoe is what's changing the functionality of the foot. So here we have a neutral shoe. This is an ASICS Nimbus. It's a shoe that would be used for a average arch height to a higher arch height. And the key to those is that the shoe needs to be moderately inflared. Now, an inflare shoe means that if I draw a line up through the bottom of the heel, for me to go through the toe, I'm going to have to turn in and move so. That is a much better shoe shape for your average arch to a high arch type of foot. For the flatter foot, you're going to want something which is a little more straight last, so that when I draw a line up through the heel, it actually goes through the tip of the toe. Okay, and you can get straight last in neutral and inflare in neutral. So in summary, it's important that shoes are fit primarily in the afternoon. It's always good to go to a store that has people that have some basic training in fitting of shoes. The shoes need to make sure that they bend in the right place, and they don't necessarily have to have the traditional components that we have regarded as required for motion control. And I would tend to leave the choice of the specific choice of the shoe, especially when you have a client who's got injury or pain, to a professional who has some training in footwear and foot orthoses. And the less gimmicks possible, the better. Some of the softer soled shoes increase the tendency for injury because of lack of proprioception as you hit the ground. So we're getting back to a stage where a neutral basic running shoe of a good name brand is probably the best bet to go.